Hi, my name is Rusty Suthoff, and I did my community health project in Opelika, Alabama, in Lee County. It's located on the east side of Alabama, about 30 minutes from the Alabama-Georgia line. And I did this project on diabetes and specifically diabetes education in adults. Diabetes is a disease process that affects people of all ages, and 1 in 10 Americans have diabetes. That's 37 million people in the United States. I will specifically discuss diabetes in adults, which is type 2 diabetes. 90 to 95% of people with diabetes have type 2 diabetes. And in the United States and in Alabama, diabetes is the number 8 cause of death in both of those. And as far as the stats of 2020, 100 and over 102,000 people passed away due to diabetes or complications due to diabetes. So the first thing that I did was evaluate the health needs in Opelika, Alabama. The way I did this was by doing a health data sheet that was specifically about Opelika and Lee County to figure out the demographics and some of the things that were needed in the area. And then I did a windshield survey that took me around the area to look at the housing, different buildings in the area, and to just kind of see what Opelika was about and what they had to offer. And then a key informant interview, which talked to somebody in the area about what they believed was the highest community health needs. So by doing this, we come up with diabetes and um, and that the diabetic patients seem to need the most education. So by doing this evaluation, we figured that we were trying to lower the amount of hospital visits by diabetic patients. And the way that we would do that was to provide diabetic educational materials to those at risk. Opelika is located on the east side of Alabama, roughly 30 miles from the Alabama-Georgia line. It is home to 30,995 people, which is up 17.1% from the 2010 census. It is one of only 3 counties that have increased during that time, which is Baldwin County and Madison. And Opelika is home to Southern Union State Community College and is the neighboring community to Auburn, which is the home of Auburn University. In the Opelika community, 66.2% of the population are adults between the age of 18 and 65. This will be our target population for this project, and the reason that we are looking into this is because there seems to be a lack of education regarding diabetes as a result of patients' repeated trips to the emergency department with high or low blood sugars, or not controlling their blood sugar by not having medications, not being able to find a primary physician, which is another issue that we found and that we would talk about a little bit later on in more detail. But physicians in the area range the ratio from physicians to people in the community is 2,060 to 1. So the lack of primary health care providers in the area is a large issue, and it's one that we will talk about. Healthy People 2030 sets data-driven national objectives to improve health and well-being over the next decade. So these are goals that we will try to get to by the year 2030. So the goal for diabetes is to reduce the burden of diabetes and improve quality of life for all people who have or are at risk for diabetes. So there are several diabetes objectives under this goal, but the one that I chose to focus on the most, that I believe is in direct relation to my project, would be increase the proportion of people with diabetes who get formal diabetes education. And by doing this, getting formal diabetes education will help people gain the knowledge, skills, and abilities they need to manage their conditions. This is key to improving health outcomes in people with diabetes. As I stated earlier, Opelika is located on the east side of Alabama in Lee County. Opelika is home to 30,995 people and covers roughly 62 square miles. Opelika is home to Southern Union State Community College, and its neighboring town or community is Auburn, which is home to Auburn University. People come from all over to visit Opelika due to places like Tigertown, which is places that people can go and shop and eat at local restaurants. Uh, Opelika also has a sportsplex, which hosts events and movies, sometimes concerts. Um, Opelika is home to East Alabama Medical Center, which is the hospital in the area, the largest hospital in the area, and the next closest one is about 30 miles away. Opelika has an upcoming historic downtown area and a restored historic district. Opelika also has a golf course called Robert Trent Jones Trail that hosts a professional golf event annually. The age of the homes in the historic district are anywhere from the early 1940s on. Um, this is an up and coming area, and it's very nice to drive around through. People with running and walking their dogs. A lot of the houses around the schools in the area are very nice and up and kept up as well. This is a very nice community. Again, that's located on the east side of Alabama. So for my key informant interview, I talked with a nurse practitioner, Dr. Huff, that worked in the emergency department at East Alabama Medical Center. And some of the things that we discussed was the newest addition was a freestanding emergency department that is actually in Auburn, but is located in Lee County, where people can go and get help. And then if they need additional help, they can come to be taken by ambulance to Opelika, the main hospital. One thing she did discuss for areas of improvement was community health nurse and follow-ups in the area. Some of these patients that leave don't have anybody to call them, or they do call them once and then they're not contacted again. So this may be an issue in the area. But the major concern was not enough primary health care providers. Dr. Huff specifically stated that there was a lot of physicians in the area, but there was a lot of specialties. So there really needs to be more primary healthcare providers or general practitioners, general physicians in the area to help with the community. So the nursing diagnosis that I come up with the help of Dr. Huff was, I'm going to start with number 2, lack of family medicine availability in adults in the Opelika community related to lack of general physicians as evidenced by repeat visits to the emergency department by patients for disease process management. So people keep coming into the emergency room. They don't have a general physician or anybody to go to in the area, so this has become a problem. Increased occurrence of gout in adults in the Opelika community related to lack of educational materials on foods that cause gout and reoccurrence of gout as evidenced by patients' repeat trips to the emergency department for pain in their joints. And then the one that I focused on is high risk of complications due to diabetes in adults in the Opelika community related to lack of educational materials and general physicians in the area as evidenced by patients' repeat trips to the emergency department. So for the intervention that I come up with for this project was to create a patient pamphlet with educational materials regarding diabetes. For this, I also recorded a YouTube video and added support for the pamphlet, further explaining the disease process, and put a QR code on the pamphlet so that patients could get to that video easily. And then I went to the hospital at East Alabama Medical Center, and patients that come in with diabetes got this pamphlet. So they were handed this pamphlet. We went over the pamphlet. We talked about it, seen if they had any questions, and also were educated on. There was a list of primary care physicians on the pamphlet, so we talked about the importance of that and making sure they called and got an appointment or tried to find a primary care physician. And just to know that there was further information to help besides coming to the emergency department. So these are an example of the pamphlets. The next two, it's really just signs and symptoms, how to stay connected, who to get in touch with, the health department or your primary care physician, how to find the primary care physician. And this is what diabetes is. Some of the statistics behind it, and then some of the things to change in your lifestyle, whether it be foods or physicians trying to get physicals and schedule yearly eye exams and physicals, get vaccinated, different things like that we discussed with the patient and made sure that they understood by telling that back to me. And then they were given this pamphlet to take home with the QR code if they chose to watch the video. So the immediate goal was for the patients in the emergency department to report understanding of the teaching, and also if they wanted more teaching, they could watch this video for more teaching. And then by doing that, there's a lot of good information on YouTube and different things. So that's the immediate goal. And then an intermediate goal is just taking this information and putting it into their daily life, whether that be a week down the road, a couple months down the road, several months down the road. So that would be the next process, finding a primary care physician to better treat diabetes. And then a long-term goal is using this pamphlet in this video will keep them from having to come back to the emergency department due to diabetes. So within the next year, whether it's them or another individual that they've talked to throughout this time, just educating more people on what diabetes is and trying to manage that on their own. And these are ways that we can do that outside of just this one individual. They can tell somebody and it just kind of goes down, keeps going down, and people just by hearsay. So the biggest recommendations I would have is just to find ways for us to get more educational material out. The health department is a good resource, but a lot of people don't know about it. So that's one thing that we can talk to them about. They also, people need list of primary care physicians because this is so difficult to find. Um, Again, this is something really difficult to get, but if there's a detailed list of individuals, then it's a little bit easier for people to find, and it's a little harder for them to give up. So this would be some of the things that I would recommend. So, in conclusion, diabetes is a serious and life threatening condition that, if not managed properly, can lead to other health problems. I think this is why it's very important to make sure that people with diabetes, whether it's newly diagnosed or they've had it for a long time, that they're educated on the disease and the disease process. It's important for them to have a general physician, and if they don't, to get one. I believe all of these things will help decrease the amount of people that are coming to the emergency room for management of this disease. So I hope this presentation was informative, and I hope that somebody in the community was helped by this. Thank you.